Hello everybody, my name is Rahul Nair and I'm here to talk about our project, the Acoustic Impedance Bone Densitometer. My colleagues Furqan Zargar, Nilofer Nisha and Pratikshita Bhattacharjee and I have come up with an alternative to contemporary bone density measurement devices. Our device is cost effective and exposes the patients to less radiation. We hope to achieve a preemptive measurement device. The aim of our project is to come up with an alternative which is cheaper and does not expose the patients to as much radiation as other contemporary devices. Our project deals with the universal problem of osteoporosis. Osteoporosis is a systematic skeletal disease that causes a gradual degradation of bone density. Although there are several medications that can combat osteoporosis, it is medically advised to preemptively take care of the condition before it worsens. Osteoporosis can cause fractures in the spine, the femur, and in any other bone essentially. An estimated 200 million cases of osteoporosis are noted every year worldwide, out of which 26 million cases are noted in India alone. In Europe, Japan and USA, 75 million cases are noted every year. It is also understood that osteoporosis affects a vast majority of women over the age of 40, and this is why doctors advise that women should start calcium supplements when they hit menopause. Several other devices that are used these days to measure bone density are the PDEXA, ultrasonic bone densitometer, etc. The disadvantage with these equipments are that they are not portable, they are not user friendly, and also they're very, very expensive. Our device, in contrast, is less expensive and it has no radiation involved.
Our device basically concentrates on detecting early osteoporosis based on the principle of acoustic impedance. So here we are striking the proximal part of tibia by the help of a motor which passes stress wave, and this stress wave is sensed by two piezoelectric sensors. The first sensor is kept on the medial condyle and the second sensor 10 centimeter below the medial condyle. So the stress wave is passed from the proximal part of tibia to the sensors, and the sensor senses it, and for the data acquisition we use a PIC microcontroller. The difference between these two values are taken for to measure the bone mineral density for each and every patient. Moving on to the hardware, this is the electronic hammer that we use in our project. It's basically AC motor and it has a solenoid coil inside. Also an inbuilt spring inside this, so that helps in recoil movement of the hammer. It runs on 220 volts and 50 hertz frequency, and it gives a force of 49 Newton approximately. And during the demonstration you will see that we will be giving 3 impulses from the hammer, each after 1 second interval. The hammer strikes the proximal tibia exactly at the medial condyle of the left tibia, and there will be 2 sensors placed. One will be placed below the tibia bone and the other will be placed 10 centimeter below the. This is the piezoelectric vibrational sensors that we are using in our project. This is the reference sensor that will be placed below the medial condyle of the left tibia. This sensor will be placed 10 centimeter below the medial condyle, and the values from both the sensors will be displayed on the 48-pin LCD display. I don't know if it is 48-pin. 16. This is a PIC microcontroller. It has flash memory and the programming or debugging is done using MPLAB. It can be connected to the computer using RS-232 port. The board receives power supply using an adapter, 12 volt adapter, and this is the reset button.
The sensors are placed along the axis of the bone 4 centimeters apart. The first sensor is known as V1 and the second sensor is known as V2. The hammer strikes just below the knee at around 4 strikes per second. This force is translated and picked up by the piezoelectric sensors, which then calculate the force, impact force, and send it to the data acquisition circuit. First, the patient's height is measured, and then we measure the weight of the patient. The patient then places his or her left foot on the DEXA, and the DEXA measurement of the left calentus is taken. The patient details are added into the user interface of the DEXA software, and results are obtained for the same within minutes.
For acquiring the results, two different age groups were taken, ranging from 20 to 30 and 55 onwards. The standard procedure was followed in DEXA scan as well as for acquiring the readings in acoustic impedance bone densitometer. The readings were noted down from the acoustic impedance bone densitometer, and different parameters were noted down from the PDEXA, like the height, weight, age, T-score, and bone mineral density. On the basis of the readings acquired from the acoustic impedance bone densitometer, the ranges were decided to select the condition of the patient. If the patient is suffering from osteoporosis or osteopenia, or if the patient is normal.
If the readings are above 21, it's normal. If it is between 18 and 19 and 21, it is osteopenia. If it is below 18, then the people are suffering from osteoporosis.
Graphs were plotted separately for the older subjects and the young subjects, and a standard deviation was found. The graphs were plotted and they were compared with the readings of the PDEXA, and it was found that the readings are very much comparable. By the inference of the graphs, it's evident that our device is working satisfactorily.